Hello everyone, it's me, Albert, here in my Medicare series, Aprendiendo con Alberto. Remember, I am here to help you understand your Medicare benefits, the differences of, and how to maximize. I also want to remind you that my healthcare educator's website is right here. My phone number is right here as well, 956-622-8740. If you have any questions about anything that I teach, feel free to reach out. I'm here to help you. So, to me, this is a very important question. What is the difference between original Medicare and Part C of Medicare? What is the difference? Do you at least know one difference? Well, I'm gonna go through a long list, and in my first video, Understanding Your Medicare Choices, I started mentioning some of these differences, but now I'm gonna get into the details. So let's get started. Original Medicare versus Part C of Medicare. The first thing is, who do you go see for your health? The doctor. So what's the main difference? Original Medicare, as long as the doctor says yes to this card, you can see that doctor. No problem. As long as the doctor says yes to this. Now, Part C of Medicare, you're gonna get a private insurance, a different card. You no longer show this card. You don't show it anymore because now you have a new card. You no longer show your Medicare card. You're gonna show your Part C card, whatever company you have, whether it's Bravo company, Charlie company, whatever company you have, you're gonna show that new card. Put this one away. You still have to pay for Part B no matter what. Remember I said that. You have to pay for Part B always. But doctors, here, as long as they accept Medicare, good, they can see you. Now, under Part C, guess what? Your Part C, whether it's an HMO or PPO, will have doctor networks, and you have to check those networks and make sure that they're a network, especially if it's an HMO, so that they see you. Because if it's an HMO and you see a doctor that's not accepting that plan, you're responsible for all the costs. So don't forget, check your doctors. Under Medicare Advantage, please. You have, under Medicare, original Medicare, one big advantage, it doesn't require referrals. You can go see your specialist anytime, and it doesn't require it. Now, the specialist you go see may ask the primary care doctor, I want a referral, and that's fine, but it's not required. But under Part C of Medicare, most of the time it's required, depending on your plan. But like in the area of Texas where I live, the doctors are so used to the referral situation that most of them ask for a referral anyway. So depending on where you live, the doctors may say, no, I don't need a referral. You have a PPO, I understand. Good for you. It all depends on where you live. But the bottom line is, Part C will require some referrals depending on your plan. I also want to remind you that Medicare has deductibles. Remember those deductibles I talked about? Part A deductible, Part B deductible. And remember, if you have Part D, well, Part D also has deductibles, okay? So, and then that famous 20%. All right, so original Medicare, these are your costs. Now with Medicare Advantage, the costs vary, and what happens is they give you co-pays. They'll give you co-pays, and in some cases, they will give you the 20%, just like original Medicare. So one good example is like a cancer situation or medical equipment. Here, under Medicare, if you need a bed or oxygen or a wheelchair, they charge you 20%. Under Medicare Advantage, it may be the same 20%. But over here, you have deductibles. With Medicare Advantage, guess what? They're gonna charge you a copay, a flat fee. It's gonna be known what you're gonna have to pay for a doctor visit, an ER visit, ambulance visit, ambulance situation. So the costs do vary, but the bottom line is they're affordable. All right. So do not forget monthly premiums. Your Part B, you always have to pay this, and the same thing with your Part C. You have to pay for Part B always. It doesn't matter if you join Part C, you have to pay the premium, okay? So just have to say that. And I'll have to remind you that the Part D, if you're under original Medicare, this has a separate premium. Okay, this has a separate premium, and with Part C, guess what? The premium is included. So there's one benefit here for Medicare Advantage because it includes Part D with it. So now let's continue. let's pretend for 1 second. You have original Medicare. Here, I'll use my card again. You have original Medicare and you have a heart attack or a stroke, cancer, and you only have Medicare. Guess what? This 20% can be extremely costly. I say this with as much seriousness as I can. Why? Because when you get your bills, you may see $1 million bill, a $1.5 million bill for these expensive open heart surgeries, cancers, whatever the situation may be. You're responsible for 20%. So there's no limit. There's no limit on what you pay under original Medicare. Under Part C of Medicare, they have this thing called a max out of pocket. This is basically a limit for you. So depending on the plan you decide to join, it will tell you the maximum out of pocket for this year is $5,000. And if you have a heart attack, you're only responsible up to that limit. So it just depends on the plan you join. HMOs have lower limits, PPOs have higher limits, but there's a limit. You're not responsible for the 20% anymore. So there are advantages to both and disadvantages to both. And that's what I'm hoping I'm making this clearer for you. I truly hope I am. So let's continue. And if I'm not making much sense and you just need a little bit more help, call me, 956-622-8740. Call me. All right, now let's keep going. I keep talking about this Medicare supplement. This Medicare supplement has a separate cost, but it's gonna help you with these costs right here. The supplement's gonna help you with your A, B, D. A and B only. Part D is separate. You have to buy Part D separately. All right, and if you wanna join a Medicare Advantage plan, guess what? You can't join a supplement and have Medicare Advantage. I keep saying that. I don't want you to forget, if somebody's trying to sell you two kinds of insurances, it's illegal. You can't do it. So don't let somebody try to do that to you. All right. Original Medicare has rules. The federal government says this is the entire list of things you have to cover. It's everything medically necessary, all your medically necessary services. Part C of Medicare has to do the same thing. The only difference is their costs. These have set deductibles and co-insurance. These have set co-pays. They also may have rules like authorizations and referrals, but the bottom line is it has to cover everything Medicare covers. Part C, Medicare Advantage, has to cover everything medically necessary as well. Now, one advantage to the Part C, the Medicare Advantage plan, is it has extras like dental, hearing, vision. So that's one of the perks that Part C covers. And also, I have to remind you that some Part Cs include drug coverage. I have to remind you, some may include it. If you're a veteran, TRICARE, any of those situations, you may not need Part D. There are plans with just healthcare, A and B. So if you need help, call me. I'm here to help. The last topic, and it's a very important one, foreign travel. If you're traveling, like I live in Texas, if I'm going to Mexico, will my Medicare cover? Original Medicare will not cover you out of the United States. You have to buy one of two things, or you have to have travel insurance. That's the main thing. You have to travel. If you're going outside of the country, travel insurance. Now, if you join a Medicare Advantage, this is another advantage of this. If you're in Mexico and something happens, guess what? The Part C may say, we will cover some foreign travel up to a limit. And so that is another advantage of the Part C. It will cover some foreign travel. Now remember, this is emergency coverage. You're in a different country, you have a heart attack, a stroke, you badly injured. If you want to go to Turkey because it has the best hair care or whatever, they're not going to cover that because that's elective. Anything that you want to do outside the country, because you hear, Spain has the best this, and this has the best that. It's not going to cover it. That's routine care. Medicare is not going to cover any kind of routine care. We're talking about emergency travel. So I've seen it with personal clients where they bring their bills back to the country, back home, and what they do is they submit the claims to the carrier, and the carrier, the Medicare Advantage carrier, reimburses them up to that limit. So another advantage. I hope this helps you understand the difference between original Medicare and Part C. And as you can see, it's a lot of details. But the main thing is the costs and the rules of each option. Those are the things you have to consider when deciding on what you want to do. But I truly hope this presentation helped you understand the difference between Medicare Advantage and original Medicare. Please continue to share my videos. Healthcare, my website is here on the screen. And again, my number, 956-622-8740. I'm truly here to help you. Please reach out. I appreciate you sharing my videos with your family and friends. Again, my series, Aprendiendo con Alberto, the Medicare series. Please share my information. I know it's going to help and change lives. So thank you for helping me get out there, reach my message, and change people's lives. So thank you very much. We'll see you at the next one. Thank you, guys.